don't do your SIR because a CWC has given you an order as part of your job, but do it as a commitment for children. Because when you do one SIR, think only of that one particular SIR, particular child. Because you are working on that particular child. A good SIR can give a very good order. SIR is the base for ICP. So if you require a very, very good care plan for the child, rehabilitation, restoration plan, reintegration process, your SIR is a base. What you write about the child makes a difference for the child, because SIR is the eyes and ears of CWC.
I do agree that although social workers are hard pressed for time, there's a lot of caseload happening, and it's just completely understandable. Sometimes what happens, we find it easier to copy and paste from different, SARs to this SAR and quickly finish our work. But what we forget is that this most often happens at the cost of the child's access to rehabilitation and reintegration, right? So there is a need to look at the child's individual struggle because it's very unique for that particular child. We could have two children coming from the same house, from the same background, but having totally different experiences of that particular vulnerability.
What do you feel are the key elements of like a well-prepared SIR?
So from my experience of working with CWC that I was part of would look for is a bird's eye view of the child's environment, the vulnerability that they are facing, and probably the reason why the child has been categorized as a child in need of care and protection. The other aspect of what we also look for in an SIR is who are the safe people that the child could be reintegrated or the child could keep in touch with. So to even understand who the safe person can be, who can probably help with the not only the rehabilitation but the reintegration of the child, and also finally to understand what are the vulnerabilities that that the CWC can engage with. We can support or maybe file a case if necessary for this child, and to seek justice or to seek compensation or to seek some rehabilitation or to seek scholarship.
That I have to understand it first, whether what are the components that makes a child vulnerable. So the psychological aspects, the health aspects of the child, whether it is physical, mental health aspects, what are this relationship with the family, like that bonding, then what are the peer group and friend circle, and the education of the child. You do an assessment of the education of the child. At least the basic education, reading, writing, arithmetic, language, these 4 capabilities of the child. It's not important the child is readmitted during the process of rehabilitation to the class from which the TC is brought. We make a correct assessment of the education aspects. Health is from 2 parts, the mental health aspects, and another one is physical health.
What do you think is the biggest challenge in the quality of SIRs that we have?
What we keep looking for mostly is the voice of the child. It seems to be completely missing in most SIRs. It also comes from the framework that we adults think we know better than the child, right? So therefore, the child's voice often gets missed out in these SIRs because the perspective of the child looks very different from the adult's perspective. So the other thing is facts. I'm sure social workers like you are going there with a good intention, trying to see how to support the child, how to ensure that all the details are covered. But what happens is that you end up observing what's happening and putting your assumptions there. Like, for example, I could say the child's house is very dirty. So that's again an assumption from my part. Maybe I could rephrase it and say, I saw clothes lying scattered, unfolded. I saw garbage lying in a particular place. So when you mention these kind of facts that you observe, that gives much more clarity. The other challenge that I've also noticed is us putting our moral judgments into those SIRs. For example, if the child is living with a parent, with one biological father and a relational mother, because maybe the biological mother is not in the picture for various reasons, maybe death, separation, divorce. And there is a quick assumption that stepmother equals to somebody who's unsafe. Oftentimes in the CWC, I've come across cases where the relational mother, you know, the has been so much more safer than the biological mother, has been more caring, and when we start putting our assumptions, we just say, oh, the child is staying with the stepmother, and therefore is dangerous. And if it's a girl child, maybe the father is a relational father, so there is this risk of maybe sexual abuse. So we kind of put our judgments, our moral values onto that particular SR, and that could really disrupt what could potentially be a great rehabilitation plan for the child. I notice a lot of social workers do is conflict and confuse things like addiction, exploration, habituation, be it tobacco, be it alcohol, be it other substances. So very often, even if the child is just exploring with it, it's termed as addiction, and that completely changes the rehabilitation process of the child. So we need to be also very mindful of certain words that are used in the SI.
I have seen the SIs to write good, okay. They're not the word to be written. The explanation, the more information is given, the more better it is for the CWC to understand the case.
How would you suggest social worker build rapport with a child when they're talking to a child and getting information for an SIR? And
When a social worker connects with a child to start the process of the SIR, explain to the child what your role is and what this SIR is. For children, it's all adults because they face so many traumatic situations, and it's all because of us adults. Switch between two ends of trust. One is either they trust you implicitly or they completely don't trust you at all. So for you to navigate through that is the first goal. So telling them who you are, what is your role in this child's life, and what is this SIR doing for the child, I think needs to be the first thing. And that is the right of the child. I think that breaks a lot of barriers, because when child sees that somebody is coming and telling them and clearly explaining who they are rather than demanding for information, there is a level of comfort that the child gains. The next thing is also to understand if the language that we are using is something that the child can understand, which language you're using, which communication mode the child is unable to communicate through speech, if there's any other mode that the child would need to communicate. The other thing is also to ensure if the child is ready to speak to you at that point in time. We all know that children and trauma, so they are all the time on alert mode if they have faced, trauma. So when they are in that mode, communicating with them, getting authentic information from them is going to be very, very hard. So maybe assessing or understanding if the child is probably in a much better framework, has unpacked a few things, maybe has already spoken to a counselor. Are they going through some physical difficulty? Do they need some medical help? So these need to be kept in mind before even starting a conversation in the context of SIM. Once the child is in that comfortable position or zone or framework of mind, then when you have a conversation with the child, there is a lot more that flows easily. The child may be able to, list out information that may be so much more important for the child, especially when it comes to their rehabilitation, reintegration. And I would definitely recommend to maybe start asking them what is their idea of being safe? What is their idea of rehabilitation? What is their idea of integration? Who are their safe people? Who do they think that we should talk to gain understanding and a better perspective of their lived realities? Who are the people who they think might be difficult to understand their perspective? And also, if they want to understand what they want, do they want to read this SIR or want to hear back from whatever information that we've collected before it is submitted before the committee? So I think when we give that much of a space for the child, I'm sure that rapport building becomes that much more easier for social.
Be ready when the child is ready, not when you want some information child has to give. And it is not necessary child has to give all accurate answers. Therefore, you have to be waiting for the readiness of the child. So we respect the privacy of the child. Don't expect on the first day when you give form number 17 all the truth and the facts to be out. It is impossible. If somebody there was in the life of the child who was trustworthy and people have trusted, child would never say different versions which are built on certain false facts. It is important, first of all, for the social worker to build that trust. You take it as a part of the story. Even if the child has told all fabricated things. So, it is not necessary that you trust every story. Every story means you take it complete as a completed truth. But you trust the child. Need not be that trusting the story of the child. You trust the child, and slowly the child will tell what exactly is happening in the child's life.
What would you tell a social worker to keep in mind while they're visiting the family or the child's community, maybe their school, maybe their friends, neighbors, etc., as well as while they're documenting everybody's responses and writing it in the SIR?
I would recommend that going there also telling them why you're there. So to give an example, I think once the committee had asked for an SIR of this particular child from the school, and the person who went to collect the SIR mentioned, we've come from the CWC, they've asked us to do this social investigation. We say social investigation report and that's it. They all think that it's an investigation, the child has done something wrong. And while the person collected all the valid information, we then found out that the school refused to take the child after the child was sent back with the parents. And that was so detrimental for the child. So maybe instead of using words like investigation when you're going there, you can always talk about how you're collecting information to support the child. So the child is going through some difficulties and you're here to seek support. So when you say it, you're seeking support, maybe the language also would be different from the adults that you're reaching out from. So they might share certain things that maybe the child has had difficulty with, maybe behavior, maybe school refusal, or could be many such things. But they would also, provide a recommendation, say, if this would have happened, maybe the child would be no. Because when you're saying that you're coming from a space for asking their support, to help the child. So I would recommend do that strongly. And finally, I also say is to request and urge for people to respect confidentiality. Many a times, I think it's common nature. I don't know, it's human nature. We just like to keep talking. And we hear something that is out of the norm, and somebody coming from the department asking certain questions about a particular child becomes conversation in the staff room, becomes conversation in the neighborhood, and becomes conversation in the playground. So we need to be very mindful when we have these conversations.
And what do you feel the social worker should keep in mind while writing the SIR? How should they go about it?
I think as a CWC member, I'd love to see a detailed social investigation report because it gives us the bird's eye view of the child, which we would never get it anywhere else. I mean, there's no other avenue for us to get an outsider's perspective of the child's reality. So your role as a social worker is so vital, and this SIR is so important for the bench when it comes to deciding passing an order with regard to reintegration or rehabilitation, and therefore giving details is very very important. Talk to the child first before you do. So collect as much information from the child, and then do your a detailed report when you go and visit the child's space of residence. So child needs to be at the center when we're doing the SIR. And we need to build a narrative around that child when we see from the child. But we see that there is a buy-in from the child to work on that rehabilitation plan that we put forward.
For each part of the SIR, go to the right person, right professional. When it comes to the health component, go to the right doctors. When it comes to the emotional component, psychological component, go to the psychologists and counselors. When it requires for an educational assessment, go to some teacher who can do an assessment. So your role is to put together all that is done. SIR, don't give those 4 5 pages of form number 22. Your SIR is incomplete without all supportive document. If you are writing age 15, give a supportive document. If you are saying child is class 5th, give a supporting. Your SIR to be supported. Every component, every answer you write need to be supported by a supportive document.
Your top 5 tips for if you would give a new person who's doing an SIR?
Please read Section 3 of the JJ Act. And understand where these principles are coming from. So you might have to not only do that, but also maybe read the Conventions of the Rights of the Child as well. And therefore, for us to understand the reason behind why I'm doing the SIR is, I think, Section 3. So I would urge every new social worker to please take the time and read it in detail. Also, the general comment on the best interest of the child. Again, I would urge and really request all new social workers to please read and understand what does best interest of the child really mean. Yeah? And to also understand that it's not just about the child's right to education. There's so many nuances of the child's identity, the child's cultural background, the family where they come from, their right to be in connection with them, their food habits, their cultural habits, all that needs to be preserved, their safety. And then comes education. We think it's a quick fix. If the child is being given access to education, we've solved all problems. But there's so many other nuances. Keep the child at the very center. Talk to the child before writing the SIR, after writing the SIR. Get them to understand what is there, and then put in your conclusions and your remarks, because you have that in clause 40. There is an option. So with clause 40, I think is a very powerful tool for you as a social worker, because you can document what you think is in the best interest of the child. You don't have to always write it from sitting in your secluded spaces, but maybe having a conversation with the child, with whatever you hear from the family, talking to uh, the DCPO, the district child protection officer, talking, even probably having a conversation with the superintendent if the child is in the custody of the childcare institution, looking at different kinds of schemes and uh, options that the child can benefit from, be it scholarship, be it foster care. There's so many other avenues that the child can benefit from. And to keep all this in mind when you write that final observation. I have often seen this place left blank, and it's really sad, because you were the chosen one to have been able to go there and actually witness the child's reality. And we, as a committee, be looking forward to know what is it that you have felt when you were there. So there's so much that we can gather when we are physically there. And therefore, I feel elaborating the clause 40 and putting down all these observations and your experience of how you felt when you went met these people. What was your takeaway from it? How do you think the child can benefit from various other initiatives that the government has already put forward to, and how the CWC can ensure this can be, given to the child? And I think that is very, very important. And I know that all of us here, including you social workers, are doing what is best for the child.